And I just thought, like, how is this really getting back to the people who need to use this? I think in a lot of cases it doesn't. It's a problem that it's called like the research translation problem. It's studied, and I think other people are trying to sort of fix it to get research into the community setting faster. But I just thought, this is what I want to do. I want to be this bridge between the academic setting and the community health setting, and be helpful in that way.
Nina, good morning. Welcome to the podcast. Grow Healthy, Help People is a podcast that Accordis, our company, does, talking to nonprofit leaders that are making a difference. How's your day going?
It's going really well. How's yours?
It's been good here in Tennessee. You're calling in from where?
Westchester, right outside of New York City.
That's great. And you and I talked a little bit earlier. You live kind of all over the country in all four corners of the country. Well, three of the corners. Have you lived in Southern California yet?
We haven't made it to Southern California, but we have been
Okay.
in Northern California and Oregon, Chicago, Florida, New York. So
You've been all over.
yeah.
That's great. So I'm excited to learn about CHIRP. Tell us a little bit, just as we're getting started, what is Community Health Innovation and Resource Project, CHIRP?
So we are a nonprofit, and we offer free, what we're calling research translation services,
Okay.
to other nonprofits who work in the public health realm. And so what this means in practice is that if you are a nonprofit and you run some type of health programming, which can be anything from like youth development services to clinical services to lifestyle and behavioral interventions, we can help you with that program. So we can do evaluations, see how the program is running. We can help you find more up-to-date research to adapt the program if you need. Or if you have a new health problem you're trying to tackle, you can come to us and we can walk through some program development options, sort of what the research is saying for how to best solve this health problem, and support you through that process. And all our services are free, and our aim is really just to help nonprofits improve health programming.
Awesome.
Yeah.
I'm gonna say back to you what I just heard.
Yeah.
You take research that has been already done and help organizations apply that research and even use that research to further the impact of their programs. Is that right? It's all like research program connection related. Is that right?
Yes. I mean, I can talk a little bit more about how that developed, which might make it a
Yeah,
little
do
more
that.
clear.
That'd be great. Yeah.
Which is, I used to work in public health nonprofits before getting a master's or a PhD in public health, and I really didn't know. I was asked to sort of develop programs and run programs. At that time, it was mostly youth development programs and diabetes prevention programs, but I didn't have any formal training in that. And so I went back to get my master's in public health to try to support the missions
Yeah.
of these organizations I was working for, and realized there was this whole world of public health research and really like program development that I knew nothing about, and that would
And
really
you guys are
help.
trying to you're trying to start from the ground up and do it all your own. You're realizing there's a ton of research out there already.
Yes, and I didn't even really know where to look. And even if I think about it now, even if I found research, which a lot of times is behind a paywall because it's in academic journals, I'm not sure I would even know how to interpret that research. It's not written for people who are outside academia or the research environment. And so I really would have had a hard time, even if I was able to find the right things. When I was in the PhD, I was like, I need I need to work to get this research like back into the community setting. Like
Yeah.
that's why I started the program in the first place. And so when the PhD was done, I started CHIRP with someone else from the PhD, Ashley, and here we are.
That's great. And so today, what do your programs look like? How many organizations are you working with? Are you primarily digging in research and finding research for these programs, or are you helping them craft new programs to run because you already have research that would be beneficial to them? Tell me more about how you operate day to day.
So it's a really case-by-case basis at the moment. So right now we're mainly running one-to-one services. So someone
Okay.
will contact us and say, this is the problem that we're dealing with or the problem we're trying to solve, and then we walk them through a bunch of options. Some examples of that could be is an organization that we're working with is trying to adapt some of their programs. So they offer a bunch of sexual health services, but a lot of the funding has been cut. And so they're looking at ways to keep those programs running now that they have less funding. And so we've helped them walk through, starting with what's a logic model. So how
Okay.
could we get the health outcomes that we want, and then like walk backwards, planning, okay, what do programs need to accomplish and how are you going to accomplish those?
Okay.
And so that's like a sort of first step for them. And then we'll see
Yeah.
as time goes on what they need. Another organization that we're working with has a crisis helpline, and they help people in crisis connect to care. And so, but they don't have a way of, so far, they haven't had a way of tracking how well people are connecting to care after the call. And so we have worked with them to do some data collection by talking to participants and surveying participants who have called the helpline to see if the helpline was effective in the moment, if they were able to find the resources that the helpline provided, and whether or not they're continuing care after that like initial call, to get a better sense of how the healthline can improve and sort of where the impact for that healthline is.
So where are you serving? Across the country or across the world? What's your focus?
Our focus is across the country, although, I think at this point we would sort of help anyone who wanted help,
Yeah.
and sort of see where we can be of use. But I think, again, when this started, we've really focused on the US, because there has been a fair amount of disruption to public health right now, and we're really trying to support public health organizations in the US as much as we can.
Yeah, that's great. So tell me a little bit of your story. I mean, you came from academia. It seems like you're still in the academia realm. Tell me a little bit of your story, where you came from, and then how you ended up starting a small nonprofit after working for very large academic organizations.
Yeah, I think, well, so I was working in nonprofits right out of college and was doing public health work, but I didn't really know that I was doing public health work. I just liked the work that I was doing. And then again, when I went back to get a master's, this whole world opened up to me of public health, especially in the academic setting. And I really fell in love with research and went right from the master's into a PhD. When I was in the PhD, I got to work on a couple research projects. I got to run a research project of my own. And I also taught both undergraduate and graduate classes in public health, and got to develop course content. I got to, during the pandemic, I got to build out entire like pre-recorded courses that were, sort of developed start to finish, which was really fun. And there's a lot that I really, really loved about it, but I still felt like you do all this research, and you're involved in these projects, and then you publish the research in an academic journal, and you go to conferences and you speak to other academic people about these findings. And I just thought, like, how is this really getting back to the people who need to use this? I think in a lot of cases it doesn't. It's a problem that, it's called like the research translation problem, and it's studied, and I think other people are trying to sort of fix it to get research into the community setting faster. But I just thought, this is what I want to do. I want to be this bridge between the academic setting and the community health setting, and be helpful in that way.
Yeah. So you and Ashley are talking one evening over dinners, and you said, "What if we?" So how did you go from the idea to launching this nonprofit?
Ashley did the PhD with me. Her and I met, our first semester at Oregon State
Hmm.
University, and have had this idea for a long time. She's always worked in research as well, but she's done a lot of her research has been again in the community setting, and she's really loved that. And we finished the PhD around the same time. She did a postdoc, and I was teaching some more. And then, um, I guess about a year ago, she was finished the postdoc, and I think I was a little done teaching. And we just said we should just do this now. And so we did. We sort of took a leap of faith and decided to do it, and it included my friend, my longtime friend Laura, who has this digital media experience that is so incredible, and we really needed that. I think Ashley and I can talk public health and research all day, and yet neither of us like knew how to do any sort of marketing or or branding or website development or any of that. And so Laura's been doing a lot of that heavy lifting.
That's great. So you have this idea, you scrape a few bucks together, and it's not expensive to start, a few $1,000s to start a nonprofit usually. Then you go, man, we got to pay for domains, and we've got to pay for, payroll processing system, and then we got to pay payroll. Like, what were some of the challenges? So getting away from the big mission and realizing, holy cow, I'm running a small business now, small organization. What did that feel like to you? How was that?
Um, Certainly overwhelming at times.
Yeah.
And definitely like learning a whole new set of skills that I didn't have before. A lot of Googling of like what to do, but it's been just sort of like a slow and steady chipping away
Yeah.
at each sort of piece of its development. And I think we have a little bit of time. We have applied for some grants and we've had some initial seed money to give us a little bit of flexibility
That's
to
great.
start.
Yeah.
And so that has been really, really wonderful in giving us a
Huge.
little bit of space to find our footing a little.
Didn't know who, but the seed grant, the seed funding, that's something a lot of organizations are not able to get. They just start
Hmm.
off on day one, they're looking for $25 donations. How are
Yeah.
you able to find or connect with somebody that can give you, whether it was 5, 10, 15, 20, whatever $1,000 it was to get off the ground? What was the best way to find that person? Was it somebody that you knew or a new relationship?
It's someone that I knew and who has known that I have wanted to do this for a long time. And we've had many, many conversations about it. And they have always been interested in public health, even though it's outside the scope of their life and their day to day career. And so I think for them, it felt like a way to participate in public health in a meaningful way, in a way that they couldn't otherwise, right? They can't, they're not going to go back to school for this. Yeah.
They had a desire and a need to get involved, and you had a desire and the skills and the time and the bandwidth to get involved, and so the connection of those two things is a good spot. How neat. How really neat. That's cool. And then you get to report back to them the work you're doing. They get to see the impact they're having. So it's like a win-win. Everybody's happy about the results there.
Yes, very much so.
That's great. What are some of the challenges that you see running a small nonprofit now? Like, what are the things that land on your plate where you're going, man, I never signed up for this?
Oh my gosh. So many small day-to-day things. I was talking to both Laura and Ashley about this the other day where like
Yeah.
just you think you have like a whole list of small tasks that feel like small tasks that are just like, okay, we need to like set up a credit card or I need to change this thing on payroll or we've set up an HRA and we need to adjust some part of a claim and
Yeah.
whatever. And I'm like, oh, these are each going to take like 15 minutes. These are quick little things that need to be solved. And and then it's like I get like one done and it takes 2 hours and it's followed by like a host of other follow-up questions that I don't have the answer to. So there's been a lot of that. But I think that's just part of the learning of it. And then once you do it once, then you sort of get a feel for it, and have a better idea of what you need to do. But I think like while I have all this sort of training and expertise in public health and research, I don't have anything in running a nonprofit, and so all of that is new. And so it's been really fun learning, and it's been really slow learning, and I just sort of take my time as much as I can.
Yeah. Well, as you and anyone watching this podcast, if you find yourself in that same spot where you go, man, there's a lot of work to do, and I have to learn this thing one time. I'll never have to use it again, but I have to learn it all the way one time. Accordis, our company that does this podcast, that's what we do. We do back office for nonprofits. So Nina and others watching this podcast, if you're interested and need help in the back office side of the nonprofit, let us know. Accordis.com. We'll put our website, and Nina will also put your website at the end of the podcast. So if people want to reach out to you, Nina, and learn more about CHIRP or get involved in some way, what's the best way for them to do that?
You can go to our website, communityhealthproject.org, and we all have our emails listed, and we also have like a contact form. If you have a specific question for me, feel free to email me, and if you're interested in working with us, you can fill out the contact form, and we would be happy to work with you.
On a lot of these podcasts, really the only call to action is donate. But it seems like for CHIRP and for you guys, I mean, donations would be great. There's also how many thousands, probably hundreds of thousands of organizations that are doing work. They could even be small community organizations that are trying to, I don't know, maybe how about this? Why don't you give me a couple of bullet points of like what might organizations be doing that you could help them tie research to what they're doing? Like, what are some areas? Is it obesity? Is it academic? Is it, what are the areas you might be able to help pull some research in to help them in their programs?
So, my background specifically is in weight stigma and eating disorders and disordered eating. So, if you work in any of that realm, I have specific expertise in that and can help. And this could be extended even further if you want to if you're doing obesity prevention programming and you want it to be include elements of diet culture or weight stigma or weight bias in that. I'm happy to consult on that and help. And then Ashley's area of expertise is sexual health. And so if you are doing anything related to, HIV prevention, anything to do with STI testing, or even anything to do with sort of youth development programs, and you want to incorporate some positive sexual health framing into that, we can help with that. But I also think if you work in again, just sort of public health more broadly, and you're curious about how a program could be improved, or you have something new that you want to tackle with your organization, you can reach out and we can have a conversation and see how we could help or how we could work together in a way that's helpful to you.
That's awesome. So sure, CHIRP would love for you to make a donation, but even more, maybe reach out if you have a program that you're running and you'd like to apply research to that to see how you can maximize the impacts of your program. So Nina, one last question. Where do you see CHIRP in 5 years? What's the dream situation of CHIRP in 5 years?
Gosh, we are, so we have one-to-one services at the moment. We're also building out a resource library and hoping to also start providing some webinars or support groups for people who work in public health to have a place to connect and talk about their issues or maybe find partnership and collaboration that way as well. And so I would hope in 5 years that we have a really wonderful resource library that's completed and a really robust network of public health practitioners who use our services and have connected to other public health practitioners to support each other. That would be
Awesome.
the dream.
Awesome. Thank you for the work you're doing. What you're doing matters, and good luck as you continue running this nonprofit, and have a great day, Nina.
Thank you, you too.
Blessings.